alternative therapies are all about movement and relaxation. So we're a little more relaxed and interactive with this talk. First and foremost, I want to say how grateful I am to be invited again to this very special circle of hope Aki and you have created. As we touch on alternative therapies, I would like to interject that this support group lifestyle is my favorite therapy, and probably yours too. Sharing this challenging journey together the way you do, I can see brings purpose and light to each and every one of you. It's rather infectious. You can truly feel the beautiful flow of energy as you lean on each other, which keeps you moving towards hope and life. I think it would be really nice to have a break and do some stretches, maybe undo the traveling and the sitting that you've already done. If you want to join, you can stand, you can sit, or you can just absorb the stretching energy. And I had people last time come, we did Qigong in the morning, and we had a great time. And I love their energy. If they would come back out, that would be great. And we're just going to do 2 Qigong movements just to get started. It was at the end of my lecture, but I figure it's fun just to kind of do it in the beginning. So if you want to, I'm going to jump off of the microphone. We'll just get into a standing or sitting position, whichever one you want to do. Oh, yeah, so here, so scout him off. So you're a Seema, who are you? Where is this? Okay, so we're just gonna get in like a nice hip distance apart with our feet. And, let's just kind of rock them back and forth, just gently kind of feel the ground underneath us, kind of get out of our heads. Yeah. And then just let our fingertips kind of draw down to the floor. Kind of you see your balance, right? It's kind of gets off from all the traveling. And then as we take a breath in, it doesn't have to be deep. It's as far as you can go just to activate. So maybe it's just your first rib or your sternum. We're not forcing it. So take an inhale and exhale. Inhale and exhale. Okay, and then we can come to a nice standing position, get kind of rooted into the floor. And one of the things about sitting is our pelvis gets a little stagnant and our diaphragm gets stagnant. So we're going to pretend like we're made of water, and we're going to just kind of grab that life force of like water and pull up the pelvis, pull up the diaphragm, and then we're just going to go down. Here we go. And again, envision the pelvis, diaphragm, under pushing, and then down. And one more time. And that's release. Now this time we're going to add a little, one arm up to the sky, and one arm goes down to the floor. So on this time, we're going to inhale, and one arm goes up, and the other one goes down. And then when we exhale, we bring down. Alright, here we go. I practice in Phoenix, Arizona, and sometimes Kentucky, California when it's too hot. I am passionate meeting patients where they are and partnering with them to create wellness plans to integrate with their treatments. Each person responds and reacts differently. It's important to empower the patient and the caregiver on their journey. I support holding space, allowing the person to feel free from the external and internal challenges for brief moments, and listen and observe their own mind, their own body, and their own spirit. Together we can find the right alternative therapy that fits their needs, allowing the body to flow as harmonious as possible. I'm also passionate about sharing these tools for home self-care. I find this is beneficial for both the caretaker and the family. Okay, so these are going to be alternative therapies to help relieve common cancer-related symptoms in the comfort of home. One of the sages from ancient times says that the qi that circulates in the body is similar to the water that flows in a river. I tell my patients I'm a plumber, that's it. So that kind of leads, if the water is clear and flows smoothly, then there's no blockages or stagnation. But if the water is dirty or blocked, then it can cause illness or disease. The same is true for the qi in the body. Okay, so the alternative therapies I wanted to present today, and we're probably gonna get to choose one of them or two of them. So we have acupressure, ear seeds, Qigong, which we just did a little bit of, gentle guashas. I have little guasha tools on the table. And then we talk about foot soaks. So our main symptoms that we deal with in cancer patients, the related symptoms is the nausea, pain, anxiety, and neuropathy. Before trying any alternative therapy, including acupressure, guasha, foot soaks, it is important to consult with a qualified healthcare professional. These therapies are not intended to diagnose, treat, cure, or prevent any disease and should not be substituted for medical advice. It is also important to use caution when attempting these therapies, as improper use could cause injury or exacerbate existing health conditions. Always follow instructions carefully and discontinue use if you experience any adverse effects. Side note, I gave somebody some acupressure points to do, and that was one of the stomach points right here. And I did not carefully tell them how to do it. They came back with a huge bruise. And I said, well, what are you doing? He's like, oh, well, it was working, so I took a broomstick and did it more. So I'm gonna be very careful, and I am in the wellness room, so if you ever have any questions on how much pressure and if you're doing it right, that's kind of important to me. It's important to avoid these therapies if you have any open wounds or broken skin in the area you want to treat. This can increase your risk of infection. Additionally, you should avoid these therapies if you have an underlying medical condition that affects your skin or muscular health. Communicating any discomfort or pain to your caretaker, to yourself, if you're doing this yourself, during the treatment is also important. These therapies should never be painful, and if it is, it's a sign that the pressure or modality is too intense. Everybody has a different level. Lastly, use clean and sanitized tools for the treatment. Your hands should be clean, especially if you use peppermint oil, and you put that near somebody's eye. That could be a very painful burning experience. By following these precautions, you can ensure a safe and effective therapy session. Okay, so in order to use Asian medicine modalities, it's important to know a little philosophy and theories behind Asian medicine philosophy. The human body's ecosystem is similar to the nature's ecosystem. So that's what they think, and that's their theory. So both have complex relationships in the same way ecosystems in nature consist of rivers, oceans, streams, land, mountains, valleys, clouds, mist, rain, heat, cold, wind, and dryness. And the ecosystem of the human body consists of organs, vessels, blood, mucus, hormones, neurotransmitters, fluids, and energy. Maintaining balance within its different systems is crucial for its health. And here we have the opposites. Everybody, I think, knows the yin and yang symbol. What it stands for, yin means the shady side of the mountain, and yang means the sunny side of the mountain. And they categorize everything according to yin and yang, and then there's things in the middle. Some things are more yin, some things are more yang. Some are things that are sun, things that warm, that light, that energy movement, sky, flowers, everything that kind of goes above, right? And then they organize it to the elements. So traditional medicine utilizes the yin-yang theory and the theory of channels and meridians to balance the natural flow of the body. The ancient practitioners used the 5 elements of fire, wood, water, earth, and metal. They organized the organs to that. And the traditional medicine theory claims that our meridians that are energy conduit. The goal is to unblock, stimulate, sedate,
warm, cool, ascend, descend the energy. The signal is sent to like a conduit, like the nervous system. Okay, and this is the 12 primary meridians. There's other meridians, but these are the 12 primary meridians, and this is how they're organized. We have lung and large intestine. They're paired as yin and yang. Spleen and stomach are yin and yang. Heart, small intestine, kidney, biliary bladder, water, other pain is this weight. And pericardium, triple wormwood, that's fire, not fur, and liver and gallbladder, which is wood. Okay, so they're usually made of stone, or gold, or wood. Ours are plastic. These are great because you could drop them and they don't shatter at your tile. So, because that's very sad. We use this for pain relief, and you can do while I'm talking. One of the things you can do is on your hand. You can use this little spot right here. And this is great for getting that circulation in your fingers, right? While I'm talking. And just move it around. That's pushing. And so we can use it for pain relief. Guasha has been shown to be effective in reducing pain, especially in the neck, back, shoulders, and the hands and feet. It improves circulation. The scraping motion of Guasha helps to increase the blood flow. It also helps with the fascia, right? It has very sticky fascia in today's society. I do have a steamer in that I like to combine it with steam, where you're steaming the body part, and then because it's not as abrasive, correct? You can use oil, you can use lotion if you like. You can reduce your inflammation. It's been found to be anti-inflammatory. And also, when you do it for like your head and neck and shoulders, it can be an immune support system. It helps, what we think, it helps open up the pores to vent pathogens and get the body, motivating it to heal itself. I think the most popular is improved skin health. I think that's where it's made its big, famous statement. There's plenty of TikTok videos and Instagram videos. Guasha has the type to increase circulation of the skin, which can then improve its toe texture and overall appearance. We were using it for headaches today. So if you have one of the places I think people get a lot of headaches, I have patients that call them their horns, right? They're right back here with the suboccipital. And, so I would go very, very gentle in the beginning because some are congested and some are a little drier. So you'll usually feel one that's more congested than the other. So, just be really careful because you're going to be moving that. You will move it, right? But we don't have to move it right all at once, right? We want to, gently get in there. You're also talking to the nervous system. So it's like, okay, I'll start helping you. But if you are forcing the nervous system, it may not help as much. Okay. And then I do all over the head. Like if you have a temple headache, gently do the temple side. This area gets very tense when we're thinking, and if you're concentrating, this is where a lot of tight fascia starts to pull on the head. My other favorite, even though it's the face and I'm not always thinking about beauty, right, is for sinuses. This is very helpful for sinuses. Not only will it help get the lymph going, it increases that circulation. So it kind of helps continue the sinus drainage afterwards. If somebody wants to come up here, I guess it will be yours. Bring your chair.
I'll test for you guys.
So of course you want to test to make sure the person can handle. Some people don't even like this, right? So, I don't know if I can do that. Yeah. Okay. Yes. So you want to just make sure somebody can handle that type of. Some people don't even like to hear their hair, right? So everybody's different. And so you kind of always, I think, on the side precaution, go towards the heart and down, right? So you want things to drain down towards the heart and through the lymphatic system. So we can go like that. And here's that nice little scene talking about, right? And we go gently at the beginning. If we can, we pull your hair over here. If you were to do it here, you want to stay clear of the carotid, right? We don't want to do that, but we can get right behind the carotids, that nice muscle called the sternocleidomastoid that gets super tight. We do that. And then we can also, this is a great place because everybody holds their tension here. We can scrape the world off of the shoulder tray. You can come here. This is great for the immunities part. I think we all get really rigid right here, right before maybe we catch a cold. This kind of just bends that area. As I had a teacher that told me if we come down towards the liver, that helps the liver metabolize that. So we can come down that rib cage towards the liver. All right. Let me do the other side. Whatever you do to one side, probably do to the other side. And then I'm going to do a little bit for the sinuses, and then we'll be done for today. Good night. And so this is a area right here, right at the bridge of the nose, on the side of the nose. We want to bring it around like that. And like I said, bring it down towards. And in the beauty world, they want you to lift up. In my world, I want to bring that down. And then come down through the transverse sinus this way. And then maybe come in there. Be very gentle in this area. And sometimes it's super painful. So, ask your patient so it feels. And then another area you can do it with sinus is here too. And the reason why I did this first, I would do this first on this side, is that things drain down to the thoracic inlet right here. So you want to drain it first here and then come up to the sinus area to help drain that down. So you don't make it worse. We can't make things worse. When we say gentle, that's pretty safe. If you see in some of the YouTube videos, they're very, very strong. The shaw is when it's raised, right? The redness is raised. And some people can look purple and stuff. That's if we're going to try to get that stagnation maybe from an injury to come back up. So we're not doing that here. We're just trying to get things moving. And that's it. So you can try it on each other.